Welcome to In the Know. I'm Mark Crosby of Quincy Access Television. I want to thank you for joining us for this particular program. Joining me today is the Norfolk County Sheriff, Jerry McDermott. Jerry, actually, welcome back. It's been a little over a month since we last spoke. So give me an update on how has this pandemic recently affected the correctional facility?
The way this pandemic's impacted the Norfolk County Sheriff's Office is that early on, when this broke, late February, early March, we put in some safety protocols and we took all these measures to keep the virus out of here. So we were fighting this invisible enemy the best we could. Everybody coming in had to have their temperature checked. We stopped all visits and all contact visits, and then all visits entirely to the inmates. We made it mandatory that inmates out of their cell have to wear a mask. All staff have to wear a mask. We have a CDC DPH questionnaire that people are asked, the standard questions. Do they have any respiratory illness, any body aches, fever? So every shift people come in, they have their temperature checked. If they're 99 or higher, they go home. So we felt really comfortable with all our protocols and our cleaning and sanitizing. So we were good most of March to the very end. We had one medical staff come down with a mild case, and she bounced back. Then I think we had an officer here, an officer there, both mild cases. And we did really well March, April, May, and then recently we did see an uptick in COVID-19 positive cases. A lot of our younger officers who, I think they're out probably still socializing, they came down with it. And then we did have an arrest made in Walpole by the Walpole PD, and that was an armed robbery of a Cumberland farm. So that person got brought into us. The temperature was hot. They were tested, and they were COVID-19 positive. So as hard as we tried to keep the virus out, we shifted gears. We knew it was inevitable, and then we shifted gears towards managing through that and having a quarantine unit, having a new man unit. If anybody came into us from the courts or from the 28 police departments, we'd have what we call a new man unit in 4A, housing unit 4A, and that became our quarantine unit, where folks would have to stay in by the date of entry at least 14 days. So we've managed pretty well, but we did have one inmate, and that story made the Boston Globe. We had one inmate who just took a turn and quickly. What was very scary, Mark, we're talking about a guy in his early 40s, 40-ish, had tested negative for COVID-19 just 9 or 10 days earlier, suddenly came down with the temperature, and it went from like 98, just under 99, to over 103 in no time at all. And he just looked awful. Appropriate medical staff took care of him. We worked with the nearest medical facility, which was Beth Israel Deaconess in Needham. He was transported by ambulance and got all the appropriate medical care. But he's still in rough shape. We believe he's going to make it, but very frightening to see just how quickly this virus can really knock somebody down. Our hope is he'll be okay. My advisor is a Dr. Wissell, an epidemiologist. She's very well regarded, and her thinking on this is somebody at that age with no underlying conditions should respond really well to treatment. But, it was pretty scary there for a while. So I had asked all of our folks here to pray, just as we would do for an officer. At the end of the day, people are inmates, but they're somebody's son, they're somebody's brother.
Sure.
And the way we were raised, you can hate the sin, but not the sinner, right? So It's a human being, and they're not doing well. So, I collectively asked everybody, say a prayer for that inmate, that they bounce back, because this invisible enemy, this virus is serious. And I fear that as it's gone on, Mark, people are getting lackadaisical and not taking this virus as serious. And my concern is that we see a surge when the kids go back to school in September and October.
We're already seeing a surge in some states.
That's right. A lot of the states that rushed to reopen everything. And I know Governor Baker has really had a lot of angst over his phased opening, but I think he's doing what's best in the interest of public health and public safety. And I credit him, because there's a lot of Monday morning quarterbacks out there. There's a lot of critics, and people are hurting. I get it. Small businesses, restaurateurs particularly. But I think managing this the way that the Baker administration has done, it's really helped to limit the surge in Massachusetts. And, not that we've been unscathed. I think we're up just under 7,700 cases. 7,700 deaths
Yes.
in Massachusetts, that's a lot. That's a lot of, people, a lot of families affected. But I think the governor's done the best job he could do with COVID-19, where there's been no playbook for something like this.
Talk about the governor and actually the Kraft family. I want to talk about how they have made testing available for folks at your
Sure.
office.
Sure. So the Kraft family worked with Governor Baker, and at Foxborough Stadium, or I think it's Patriot Place, we call it now.
I know you're going back.
Yeah, Sullivan Stadium, we're going way back. But anyway, in Foxborough, Patriot Place, they set up this testing site, and they would allocate so many tests per day just for frontline workers, for first responders, corrections officers, nurses, any medical staff. And that was a godsend, because before that, people were driving all over the state looking for a testing site. Now, one indication that things have improved a lot is that Foxborough site just recently shut down because they were testing so few people. And now there's so many more sites available, like many of the CVS locations will do a drive-through test. And recently, because of the public protests, so many large groups of people have been out taking to the streets, to voice their concerns and to march for social justice and equal rights. But that's still a large crowd gathering.
Sure.
Even though most people have masks on, the governor was wise, I think, to say, look, we're going to set up some pop-up sites and offer some free testing so that we don't have community spread.
The infectious disease response team. Talk a little bit about that and how that is
Sure.
responding.
So what we did, Mark, I looked at our response here at Norfolk County with a critical eye. We did really well for a long time, but we weren't perfect. So I pulled together the head of my medical team, mental health, security officers, environmental officers, and the superintendent. And I said, we've got all the components here to really address not only this COVID-19 virus, but a second wave, or any virus, any pathogen that we have to deal with in the future. But we need an infectious disease response team. We really got to fine tune this. Now there should be a playbook, right? Because we've been through it once.
Right.
And so that's what I launched, an infectious disease response team, which I later changed, working with the epidemiologist. We're looking at it as a pathogen response team. And we're going to have best practices in place. We're going to see how other folks are doing it around the country. And what I envision is having the Norfolk County Sheriff's Office be a true resource to the 28 communities. And if it's something as simple as going out and sanitizing the police stations, their holding cells, their fleet of vehicles, sanitizing the district courts as we've done, and the district attorney Morrissey's office. So we've done all those steps, but I want to learn what more could we do to combat any kind of pathogen, and then take what we learn and be that resource for all 28 communities. And my vision is to have one representative from each Board of Health via Zoom, just as we're Zooming now, do a Zoom meeting with Dr. Wirsell and this pathogen response team, so that we're ready if there's a spike, a second surge of this virus, or anything else that comes at us. Because let's face it, the folks that I've been working with the last 18 months that I've been sheriff, I'm working with folks that have been here 30 plus years, and they've seen everything. They've seen bad flu outbreaks. They've seen Ebola virus, H1N1 swine flu. So even those seasoned people who have been here 20, 30 years, they've never seen anything like this. And we've all learned from it. And that's what I want to do, is really harness the knowledge, look with a critical eye, what could we have done better? What can we do in the future? And then share that information throughout the county, so that when our children go back to school and when our seniors go back to socialize at, the Council on Aging and their senior centers, we can be that resource and help people, not only with an educational component, but best practices for sanitizing and keeping people healthy.
remote teaching, because that has been a component of the sheriff's office.
Originally, what we did was we had our classroom teachers and folks in programs work via Zoom, and that worked out pretty well. But then, just as we thought, we could start to bring more people back into the facility, and that was something we had safeguarded against. We wanted to limit traffic in and out of our facility, but it coincided with an uptick in cases. So we went back to the Zoom meetings, and even our clergy, part of the rehabilitation of our inmates and part of their recovery, if they're dealing with drugs and alcohol, there's a spiritual component. There's no denying it. So we have clergy for all faiths, and now they're going to be recording, pre-recording sermons and inspirational messages, and that's how we're going to work with our inmate population until such time as we can bring our rabbis and reverends and priests back into the facility. But out of abundance of caution, we kept everybody that we could possibly keep out of the facility.
You saw what happened, I suppose, when people started to come back in, and then you reacted accordingly.
For a while there, Norfolk County, we were feeling pretty good when we stacked ourselves up against the Department of Correction and other counties. For a while there, we were really doing well with one or two cases, and we thought, okay, we've weathered the worst of it. And then, as soon as we got one or two cases with the inmates, that spread, and a couple of the younger officers got it, and that spread. And it's been tough because you're talking 350 or so inmates at any given time, sometimes high, sometimes lower. Not easy to do social distancing. So we've had to be creative with our housing models, our housing plans. We've done split recreation time so that all inmates that are negative can recreate with other negatives, and those who are positive can have recreation time with those who are positive. But one big thing inside the prison is, inside the House of Correction and the jail, is climate. We always want to manage the climate so that inmates don't get rowdy, don't lash out at each other, don't lash out at our officers. So we've taken a lot of steps to keep the climate cool during this pandemic.
I guess that brings me to now another question. How do you deal with anxiety?
So we do have mental health counselors here on site. We've got a great team, and they've dealt with a lot of inmates who really do have a dual diagnosis of mental health issues and substance abuse disorder. I'd say close to 70, maybe 75% of the men and women that come into the care and custody of the sheriff have that dual diagnosis, some substance abuse, whether it's drugs or opioids, and some underlying mental health. Given the pandemic, that those stress issues, those anxiety issues, depression issues went up, and you see people that can get suicidal. So we've really been working around the clock to address that, get into the housing units, talk with the inmates, make sure that they see all the steps we're taking to keep them safe. And they talk to their loved ones on the phones. They know what's going on in the outside world. And we went down to the housing units early on, and I personally bought everybody a bar of Dial soap, antibacterial soap. And some of the inmates were like, we want to get out of here with this pandemic. We're trapped. I said, no, we're going to do everything we can to keep you safe. We got your soap. You got to practice good hygiene. And I assured them that as far as food and toiletries, including toilet paper, I said, we've got plenty of supply. And the inmates were delighted to hear that. And I explained to them that on the outside, when we're out shopping at the supermarket, early on, you couldn't find toilet paper. Right. And they couldn't believe it, but they do talk to their loved ones on the phone, so they appreciated that.
And that brings me to the Supreme Court ruling, and talk about that, because there is certainly a big safety aspect involved.
I am still bewildered that case was decided the way it was. The Supreme Judicial Court ruled with the defense counsels, the defense attorneys, CPCS and the ACLU and Prisoner Legal Services, all these advocates who said, let the pretrial detainees out, right? Let them out because they haven't had their day in court with the judge and have been sentenced. So the pre-sentence population, just let them out if they've got these certain conditions and if they're not being held on a very serious crime. So there was some criteria. The judges ruled in favor, even though 14 sheriffs, including myself, 7 district attorneys, the Mass Chiefs of Police Association all said, please don't do this. Yes, we have a global pandemic, but you're talking about inmates, really an at-risk population, many people with drug addiction issues who don't have family that want them back right now, right? There's a lot of strain on these families who've dealt with a loved one who's got addiction to drugs and alcohol. So there was no family reunification plan. Everything shut down. We're trying at this time to keep the emergency room beds open for COVID-19 patients. Why would you let these folks back out on the street where they have nowhere to go? So they're basically going to become homeless. And if they do pick up and use illicit drugs again, and they have an overdose, they're going to be seen by our EMS, police, and fire, and taken to an emergency room. That's the last thing we want to have happen right now. We don't want overcrowded emergency rooms. But the SJC ruled the way they did. We had it was between 109 to 112 inmates released because of court order. Not a good plan at all from a public health or public safety point of view. And in some counties, they've seen fatal overdoses of people that were court-ordered releases, and they got back out, picked up, heroin laced with fentanyl, and they died. And so for the advocates, the ACLU and the Prison Legal Services and CPCS, if you really care about that at-risk population, these inmates, why would you have them leave with no services? At least on the inside, Mark, we've got Alcoholics Anonymous, Narcotics Anonymous meetings, medical help, mental, behavioral help. They can get the help they need. We have the medication-assisted treatment program, which works with the inmates, not just Suboxone or methadone, actual counseling that helps them. So that's, weaning them off of heroin or fentanyl or whatever they've been using on the street. We have those services in place. Those inmates were safer in here during this global pandemic than being basically homeless on the streets. The chiefs of police did not want them back on the streets either.
And that last program, that was part of a pilot study, a pilot program, correct?
Yeah, you're correct, Mark. The medication-assisted treatment program. So my predecessor, former Sheriff Mike Bellotti, had joined in with, at that time, there were only 4 other sheriffs. Originally, it was just going to be 5 sheriffs, and then it grew to 7 that signed up to be part of a pilot program where they would take inmates who come in addicted to, let's say, heroin, and get them into a program with medication-assisted treatment. So rather than having people go cold turkey, which was the old way of doing it, they would actually wean them off slowly with something like methadone or Suboxone so they could get them off the opioids, and then wean them off. That partnered with the counseling sessions so that you're working at getting them to a place where they will eventually achieve sobriety is much better off. Now, some of them will leave and still have a prescription for Suboxone on the outside, for example. But that's like a maintenance regimen that will keep them alive. Because what was happening, and Secretary of Public Health, Mary Lou Sutters, was very keen on this medication-assisted treatment. What was being seen by medical professionals, somebody would come in, do, say, 3, 4, 5 months in a jail. Now they're cold turkey, leave, and within the first 72 hours or so, if they picked up and used, their body wasn't ready. They got a strong batch of heroin, or it was laced with fentanyl, and they were dying. So we're trying to save lives here. This opioid epidemic has not gone away. It might not be front page news anymore because of COVID-19 and because of all the demonstrations against racial injustice and everything we're seeing with the George Floyd murder in Minneapolis. So the demonstrations, the peaceful ones, and then plus the riots and the looting that's happened, that's taken over the news. And COVID-19 has taken over the news, and I suppose rightly so. But the opioid epidemic didn't go away. And we still have, our brothers and sisters out in the streets. They're somebody's niece or nephew or son or daughter, and they're still using. And I'm concerned when we look at the data at the end of this, it's going to be interesting to see how many people actually died from an overdose and maybe also had COVID-19. But this opioid epidemic has not gone away.
No, and you're right. It just basically was taken over by other news.
The other issue that you don't hear much about anymore is domestic violence.
Right.
And it's been rampant. We've actually had some very high, I can't speak too specifically about them, but we've had some very high profile arrests in Norfolk County for domestic violence, including a murder. So, sadly, during these stay-at-home advisories, victims of domestic violence have suffered greatly, particularly for the women and for the kids. Staying at home is not always the safest, and there's no outlet. So we're going to see some fallout that people maybe have not calculated or factored in. But this has been tough on a lot of people. So we've got a lot of work to do on this issue. And, I have to give great credit to Dove. They have a facility right there in Quincy, and they've just been a great partner to the Norfolk County Sheriff's Office in, helping raise awareness and to help be advocates for victims.
I do want to switch gears just a bit and just talk about video arraignments in this new normal, if you will.
I've had an attorney that's worked with me for years, John Kivlin, and way back he was the #1 prosecutor for then District Attorney Bill Delahunt. And John Kivlin worked with my predecessor, works with me still. For years he was advocating for video conferencing with the courts. And his rationale was you could save a lot of money on transporting inmates to and from courthouses. People wouldn't be making claims that they were jostled around or somehow assaulted. We have cameras in the vans anyway, but also for the environment. It's great. You're saving on gas and it's better for the environment. And we have the technology, so why wouldn't we do a lot of these appearances before the judge right from the House of Correction and the jail? We have the technology. That seemed to stall out until COVID-19. And now it's the new normal. So all the video arraignments, we have the technology. We have it set up right here. I've got a great IT department, and we've had the video arraignments going now for months, at least since early March. And I would say this, Mark, I don't think the courts will be back up to really where they were until maybe late September. Now, there's some talk of them opening up a little bit sooner, but to get fully functional again and have jury pools, I don't see that until at least September, maybe late September for the courts. But that's also had an impact on our inmate population count here. So we've seen a decline from probably a high of 450, 460 down to like a low of 309. And that's just people getting out because of the court order. That's people getting out because their sentence was up. But also we haven't seen a lot of new arrests, because I think the state police as well as local police were, during the COVID-19, they may not have been making as many stops.
Okay.
And you would have to do something pretty egregious to get arrested.
Right.
But I think that'll change too come the fall. I think you'll see more people being stopped for, motor vehicle violations and folks texting and driving. And sadly, when the bars and restaurants open back up, fully functional, you'll have more drunk drivers. But so many factors impact the way we do our job up here at the House of Correction and the jail. But we have seen an uptick recently. You may have read there was a sweep, which our guys were part of that sweep with the U.S. Marshals, the FBI, state troopers, and local police departments. There are about 31 guys arrested racketeering for human trafficking, drug trafficking, murder charges. So we're going to see some of those U.S. Marshal detainees. We'll house them here. And that will impact us as well, because you have to keep the federal inmates separate from the other population.
I do want to talk about also seniors and how you have been connecting to seniors during this pandemic.
Our seniors, I love them. I just, I really enjoy spending time with the seniors, particularly, so many of them are veterans or sadly widows of veterans, but they're great. But, during this pandemic, they felt more isolated than ever, being at home and not being able to have kids and grandkids visit them. So we try to reach out through Zoom and through the Councils on Aging. And we've been making seniors aware that even though many things have come to a pause during this COVID-19 virus, the scam artists have not let up. They actually swooped in. As soon as the federal government said they were going to issue stimulus checks, the scam artists began calling seniors and saying things like, if you just give us your bank routing number, your checking account, the last four of your social, we can help expedite your stimulus check. You due this money, but we couldn't get it into your account. We couldn't wire it in. And seniors were falling for it. Or they'd say, you're due a check. We want to mail it to you. Just want to verify some information before we send it out. So much like the scam artists will do during April 15 tax filing season, they surfaced during this COVID-19 pandemic with all kinds of scams. So we're doing we have a great PDF that we're sending out to the seniors, and we're doing kind of a presentation over Zoom with all the councils on aging to make sure that seniors are aware on staying safe from those scam artists, plus the whole host of programs we have, from the Are You OK program, the Files of Life, and the Yellow Dot program, to make sure our seniors, can live longer at home independently and stay safe in their home. Mark, I'll just touch on one program if we have time, is the Are You OK program?
Yes.
This was a great program initiated by my predecessor, Mike Bellotti, former sheriff. It's a model program that I'd like to see taken statewide and be the norm across the country for the National Sheriff's Association. The Are You OK program is a partnership between us, the Norfolk County Sheriff's Office, and Fallon Ambulance Service. And it works as simple as a daily phone call to check in with the seniors and ask them, are they okay? Are you okay? And it's automated, but the phone's monitored. So somebody's always listening. Either one of our deputy sheriffs like Cheryl Bambury or somebody from Fallon Ambulance will monitor the phones. And let's say it's my grandfather, and he's supposed to get a call every day at 9 o'clock, and I'm his backup person. If the phone call goes to my granddad and he doesn't pick up, they'll call me and they'll say, did your granddad have a dentist appointment, or was he out for some other reason? If he should be there, and I say, no, my granddad should be there, call him again. If they call a second time and there's no answer, we'll work with 911 local responders, and we'll dispatch somebody to your home. And in the 18 months since I was appointed sheriff, we've had 12 saves. These are people who've fallen and broken their wrists, broken their hips. We had one woman that was in the bathtub for 11 hours, and she just didn't have the upper body strength. She'd become dizzy and faint, didn't have the upper body strength to push herself up out of the bathtub. In that case, we had the police officer crawling through the window to get her, and other than a little bit of pruny skin and a slight embarrassment, she was otherwise healthy and fine. But it's a lifesaver. It's a free program, and people can call 1-866-900, and then the letters Are You OK? The letter R, the letter U, the letter O, the letter K. 1-866-900 Are You OK? Again, a free program. And during this period of time where people are shut in because of the COVID-19 pandemic, it's nice to know, it's peace of mind to know that somebody else is checking in on your loved one. So we encourage all seniors to sign up for this program. It's truly been a lifesaver. Moving from seniors now to the younger folks, you do host a Youth Leadership Academy, and that's held over the summer. Yes. That is happening, correct? It is. And actually, I talked with the mayor of Braintree, Chuck Kokoris, and there's not many camps happening anywhere. Now, we lease a good piece of land from the town of Braintree, so we are considered a private camp, but we're opening, and we're going to do it a little bit smaller than we've done in past years, so we won't have as many campers, unfortunately, as we've done in the past. But we'll do small cohorts. There'll be strict safety protocols by DPH guidelines so that the campers and the camp staff are kept safe. But we do this in Braintree. It's called the Leadership Academy. And this camp is just for a week, Monday to Friday. But what the kids get out of it, they think, Mark, when they sign up, they all think, oh, this is that place with the ropes course, and that they're just going to be doing some fun climbing and things like that. Right, because that's what you see initially. Yeah, exactly. And what we do is we work into that self-esteem building. We talk to them about peer pressure. We have anti-bullying conversations and techniques on how to address bullies. So it's it's a youth enrichment program, and by the end of the week, the kids feel so much better. They've made new friendships, they've grown, and when I talk to the parents and grandparents, they all say that was a great experience. So glad my child did it. And the one thing they all mention is the anti-bullying, because that is such a problem still to this day. And when you and I were growing up, Mark, the school bell rang and the bullying at least ended. You could go home to the safety of your own home, your own bedroom. But I have to show you, this thing right here, it's great technology, these phones.
Right.
But this allows the bullies to pick on somebody 24/7. And it allows other people to pile on. And we've had young people try to commit suicide because of bullying. Yeah. So it's truly a problem that's not gone away. And I feel, as a top law enforcement official in the county, it's incumbent upon us to get the word out there to these young people that it's not okay. And the parents and grandparents love when we talk about anti-bullying. So we're going to keep that program going. Before COVID-19 hit, we were in talks with Dean College to replicate the program over in Franklin, because what I saw was the camp in Braintree was so well attended, but it seemed the draw was pretty much Quincy, Weymouth, Braintree, and the rest of the county, we didn't have as much representation.
Okay.
So I really like to replicate it next summer and grow that program. And we made a partnership with Treetop Adventures in Canton. And what we would do out of Dean College is have all the classroom and kind of the programming piece, and then have the kids go by bus over to Canton to Treetop Adventures and get that ropes course in, because that's so important.
I'd like to end actually on the organic garden and that program that basically is sprouting right about now, right?
Yeah. So, we're always trying to make the inmates in our care and custody better people before they leave us. We, have so many different classes they can take, and we try to build a skill set. So to that end, one of the new programs is we have an organic garden that we've started, and we're teaching them about sustainability, how to plant and nurture and grow healthy fruits and vegetables. And we've started that program here in Dedham, and as it grows, we're going to try to build it out in Braintree as well. So that's a brand new program, and so far we've got, cucumbers, peppers, sweet potatoes, all planted, as well as some oregano, parsley, and basil, and tomato plants. So it's really coming along nicely, and we've got about 15 of the male inmates right now working on the garden. And then in the not too distant future, we're going to have about half a dozen female inmates come over here to Norfolk County. We moved them out of MCI Framingham because that was not a nice facility at all. So early on, I said we have to have equity for the male and female offenders. I moved all the Norfolk County female offenders out of MCI Framingham to South Bay in Suffolk County, and then eventually they'll come over to Dedham. And we'll teach them the same skill set, because when they leave our care and custody, they go home. They're moms, they're dads, they're raising little kids. So we want to teach them the skill set that can help their families, but also give them another marketable skill.
I want to thank you for joining us today, for joining me certainly. Just as we close, some contact information, the website and email.
Sure. They can go to the norfolksheriff.com or website, or they can email me direct, letter J, just think jail, J McDermott at norfolksheriffma.org. So the email ends in .org, J McDermott at norfolksheriffma.org. And most of the programs that I spoke about, you could still call the 1-866-900, the letters RUOK, and any program for seniors or kids will get you routed properly through that number.
Ideally, you will be hosting a program yourself here at Quincy Access Television.
Yes, we're hoping to do that soon in the future, and periodically we'll have guests come on, and I want to bring on the head of my medical unit, Tara Flynn, and have her talk about that medication-assisted treatment program.
Something to look forward to. In the meantime, stay well, and until we meet either via Zoom again or physically at Quincy Access Television, please take care.
You too. Stay healthy, stay safe. Thanks.